Energy-based therapy, a complete guide for patients and families. Understanding healing beyond medicines. Introduction. Why this video matters. Hello everyone. Thank you for taking a few minutes to watch this video. If you are here, chances are you or someone you love has been suffering for a long time. You may have tried medicines, treatments, investigations. You may still be searching for relief, answers, or hope. Some of you may be curious. Some of you may be skeptical. Some of you may be here because nothing else has worked. This video is not meant to convince you blindly. It is meant to explain clearly and honestly a form of therapy that works differently from conventional medicine. Energy-based therapy. 1. What is energy-based therapy? Energy-based therapies are non-invasive treatments that use gentle physical energies, such as electromagnetic fields, radio frequency, microcurrent, sound frequencies, light or other modes of delivering frequencies to support the body's natural healing processes. There are no injections, no drugs, no surgery. These therapies work by improving circulation, improving cellular energy, improving nerve communication, supporting tissue repair, helping the nervous system move from stress mode to healing mode. In simple words, this therapy helps the body heal itself better. 2. How is this different from medicines? Medicines are extremely important. They save lives. They control infections, blood pressure, diabetes, pain, and many serious conditions. But most medicines suppress symptoms, replace missing chemicals, control disease processes. Energy-based therapy works differently. It does not fight the body. It works by restoring regulation, helping the body function more normally again. That is why it is often used, along with medical treatment, as supportive therapy, not as a replacement for doctors or medicines. Very important, never stop or change medicines on your own. Any changes must always be guided by your doctor. Why full medical disclosure is essential. Before starting this therapy, it is very important to share all medical conditions, past surgeries, current medicines and supplements, implanted devices like pacemakers, previous reactions to treatments. This helps us choose the right therapy, decide the correct intensity, avoid unnecessary reactions. This is not paperwork, it is safety and personalization. 4. Why lab reports can help. If available, reports such as blood sugar, thyroid tests, kidney or liver tests help us understand how strong or gentle the therapy should be, how fast your body can adapt. People with diabetes, thyroid issues, chronic fatigue, or long-standing illness usually need a slower and gentler approach. Contraindications. When this therapy is not used. Energy-based therapy is not given in certain situations, including pacemakers or implanted electronic devices, pregnancy, especially abdomen, pelvis, lower back, active cancer at the treatment site, fever or active infection, recent heart attack or stroke, uncontrolled epilepsy or serious heart rhythm disorders. In elderly or fragile patients, therapy is done very gently and gradually. What are healing reactions? Some people experience temporary reactions after therapy. These are called healing or adaptation reactions. They may include mild body pain or stiffness, fatigue or sleepiness, headache or heaviness, temporary increase in old symptoms, short-term changes in sleep or digestion. These reactions are usually mild, temporary, self-resolving. They do not mean harm. Why do these reactions happen? When circulation improves and cells function better, old waste products begin to clear. Dormant tissues become active. The nervous system shifts from stress mode to recovery mode. This adjustment phase can be felt, just like muscle soreness after exercise. When do responses appear, and how long do they last? Some people feel changes immediately. Most reactions appear within 6 to 48 hours. Reactions usually settle within 1 to 3 days. In elderly or chronic cases, they may last 3 to 5 days. If symptoms keep worsening, last more than a week, the therapy must be reassessed. How to reduce healing reactions. You can support your body by drinking adequate fluids, including electrolytes, not excessive plain water, doing light walking, getting good sleep, avoiding heavy exercise on therapy days. These simple steps make a big difference. Stevens, regular visits and continued healing. Unlike tablets, energy therapy usually requires regular visits. Why? Because healing builds session by session, not instantly. Interestingly, healing can continue even after therapy is paused for a few days, because biological repair processes remain active once triggered. Conditions that respond well. Energy-based therapy is especially helpful for chronic joint and muscle pain, back and neck pain, arthritis and stiffness, nerve-related pain, post-injury or post-surgery recovery, fatigue and sleep imbalance, stress-related nervous system problems. These conditions involve poor circulation and regulation, where this therapy works well. Conditions that need more time. Some conditions respond more slowly. Long-standing diabetes, thyroid imbalance, severe degeneration, multiple chronic illnesses. Slower response does not mean failure. It means the body needs time and patience. Skepticism, a very important point. Many people, including doctors, are skeptical. This is natural. We are conditioned to believe healing requires medicines. Energy-based therapy works on a different principle, so doubt is understandable. But over time, many doctors, their parents, their families have themselves used this therapy and experienced benefit. Acceptance has grown through experience, not belief. 4. Last resort patients. Many people come here after years of unresolved treatment. Normal reports, but persistent suffering. Multiple medicines with limited relief. For some, this therapy becomes a last option. And for many of them, relief finally begins. Not because medicine failed, but because the body received a different kind of support. 4. Why some people want to avoid medicines. Some patients worry about long-term drug side effects, multiple medicines, dependency. Books like Death by Prescription have increased awareness about over-medication and drug interactions. Important clarification. This does not mean medicines are bad. It means people want safer, supportive options. Energy-based therapy offers a non-drug, non-invasive support system. The future potential of energy medicine. Now, I want to briefly talk about the future potential of energy-based medicine. Medicine is evolving. For many years, healthcare has focused mainly on chemistry, drugs, hormones, enzymes. But biology is not only chemistry, it is also physics. Energy, frequency, and vibration. More than a century ago, the great scientist Nikola Tesla said, "If you want to understand the secrets of the universe, think in terms of energy, frequency, and vibration." This idea is becoming increasingly relevant today. Every cell in the body produces electrical signals, communicates through electromagnetic activity, responds to mechanical and light-based signals. Health and disease do not start suddenly. They develop gradually, often at a functional or energetic level long before a physical disease is visible. From structural medicine to functional awareness, traditional medical tests often detect disease after structural damage has occurred. Energy-based approaches aim to understand early functional changes, stress patterns in the nervous system, circulatory and metabolic imbalances, regulatory disturbances before symptoms become severe. This does not replace medical diagnosis, but it adds another layer of understanding. Emerging energy-based diagnostic tools. There are emerging technologies that attempt to study these early changes. Some examples include infrared thermal imaging cameras, gas discharge visualization, or GDV cameras, biophilia tracker ultra, and similar systems. These tools claim to detect abnormal stress patterns, circulatory changes, autonomic imbalance, physiological disturbances before clear physical disease develops. Important clarification. Please listen carefully. These tools are not diagnostic in the medical sense. They do not replace lab tests or scans. They are considered screening or research tools designed to observe functional changes, not to label disease. Why this is important? Many chronic illnesses begin silently. By the time symptoms appear, the body has already been compensating for years. Regulation has already been disturbed. If future medicine can detect early imbalance, support regulation sooner, strengthen the body before damage occurs, then healthcare can shift from disease management to true prevention and restoration. Energy medicine as a complement, not a competitor. The future of medicine is not energy versus medicine. It is medicine for diagnosis and acute care, energy-based approaches for regulation and recovery, lifestyle, nutrition, and movement for long-term health. Together, this creates a more complete healing system, a realistic and responsible view. Energy medicine is still evolving. Research is ongoing. Understanding is growing. Not everything is proven. Not every claim is correct. But history shows us this. Many medical advances were first questioned, then explored, and finally accepted. Future-focused medicine. As medicine moves forward, understanding the body not only as chemistry, but also as energy and communication, may open new possibilities for earlier healing, gentler care, and better prevention. If you are watching this video because you feel frustrated, tired, or hopeless, please remember this. Healing does not always come from adding more medicines. Sometimes, it comes from helping the body function correctly again. Energy-based therapy may look different, but for many people, it truly works. Final message: a balanced truth. Energy-based therapy is not magic, not a cure-all, not a replacement for doctors or medicines. But when used, along with medical care, with proper screening, with realistic expectations, with regular sessions, it can become a powerful, supportive healing system. A message of hope. If you are watching this video because you feel frustrated, you feel unheard, you feel you have tried everything, please remember this. Healing does not always come from adding more medicines. Sometimes it comes from helping the body function correctly again.
Energy-based therapy may not look like traditional medicine, but for many people, it truly works. Thank you for listening. Founder, Holistic Wellness Foundation, Imphal.
Healing beyond boundaries. Disclaimer. This video is for educational purposes only and does not replace medical consultation.